There are a number of different types of fractures that can occur with osteoporosis. The wrist fractures are the least severe. They mostly occur around age 50 or older and may be an early warning sign of osteoporosis. Or it may mean, like for my friend, that she fell off her bike and tried to break her fall and wound up fracturing her wrist. Spinal vertebrae, these are more likely to occur between 55 and 75, and they're fractures that may occur from bending or lifting. What's been happening is that over time, as the bone has lost calcium, as it's decreased its density, there is an event that occurs that leads to the fracture in one of the spinal vertebrae. Several fractures can lead to the loss of height and curvature of the spine. As those vertebrae start to compress, it leads to spinal curvature, and fractures can also accelerate that. Chronic back pain can be a symptom of osteoporosis. However, it can also be a sign of aging. So if you have chronic back pain, don't think that at your stage you have osteoporosis. There are a lot of different things that cause back pain, but osteoporosis of the spine is one of those things. The hip fracture is the most serious, and these are what occur in elderly folks. This would be probably where the elderly osteoporosis would fall under that category. Many folks who have hip fractures at this age in their life may die. Up to 20% can die within 4 months. Up to 50% may ultimately need long-term care because recovery from hip fracture can take a long time. And when you're bedridden for a long period of time, other changes can occur in the body that may make it more difficult to take care of yourself. Risk factors for osteoporosis include low calcium diet, also a diet that's low in vitamin D, magnesium, and fluoride, family history, small frame size, so picking the wrong parents can be a risk factor. Lack of exercise, particularly weight-bearing exercise, because weight-bearing exercise stimulates those bone-building cells. Smoking and alcohol, and menopause due to the changes in hormone levels that are related to helping to maintain bone density. When estrogen levels decrease, they can lead to a change in the relationship between the osteoblasts and the osteoclasts, and they're associated with increased osteoclastic activity, which increases bone loss. Now we're going to look at minerals. This is my periodic table of dessert because, of course, I have a periodic table of dessert, because doesn't everybody? But the arrows are pointing to the different trace minerals, but the one in red is iron. And that's the one that we're going to be looking at. We have different forms of iron, which we'll look at in a minute, but it's a component of hemoglobin. Hemoglobin is a protein in red blood cells that transports oxygen in the blood. Myoglobin is the protein in muscle cells that helps make oxygen available for the muscle. Iron is also a part of many other proteins and enzymes. Anemia is a deficiency Anemia is a deficiency condition associated, by a deficiency of a number of different things. Anemia can be caused by a shortage or abnormality of red blood cells. This compromises the delivery of oxygen throughout the body, and different nutrients, deficiencies of different nutrients can lead to anemia. The one we're going to talk about briefly is iron deficiency anemia, but deficiencies of vitamin E, vitamin B12, folate, and other nutrients can cause anemias. So an inadequate intake of these nutrients can lead to anemia. Signs and symptoms of anemia include muscular weakness, tiredness, fatigue. You can see the symptoms here. But again, you can have some of these symptoms. It doesn't mean that you have iron deficiency anemia or any other kind of anemia. But certainly if they persist, it's something that you can talk to your doctor about when you have your next physical. Oftentimes, a deficiency can be diagnosed pretty quickly with a blood test called a hematocrit. This test involves taking a small amount of blood. This is a tube of blood, of whole blood, and then you put it in a centrifuge and spin it down, and you separate the red blood cells, the packed red blood cells, from the plasma. The plasma or serum layer is what's on the top. We briefly talked about plasma in previous lectures. Plasma is the part of the blood that our sweat comes from. When you are losing heat from the body, when your internal body temperature builds up and your body gets rid of it, it's transported to the skin and you lose it through sweat. And the fluid is coming from the plasma portion of your blood. But when a hematocrit is being measured, you look at the percentage of plasma to the percentage of red blood cells. And in this case, the person has about a hematocrit of about 50%. So 50% of this tube is packed red blood cells, and that would be considered a normal range. So a hematocrit is a blood test that looks at iron levels because iron is found in the red blood cells, in the hemoglobin of the red blood cells. Sources of iron come from heme and non-heme sources. Heme iron, which is about 10 to 20% of the heme iron found in animal products is absorbed. About 2 to 5% of non-heme iron is absorbed. So you can see, so this should show you that heme iron is more bioavailable or biologically available for the body to use. It doesn't mean that you can't maintain iron status from non-heme iron, that vegans can't get adequate dietary iron from non-animal sources, but it is one of those conditions, iron deficiency anemia, that vegans are at a higher risk of developing. I want to explain to you a little bit more about the difference between heme and non-heme iron. As I said, heme iron only comes from animal products. This is an example of, a hunk of meat, but it contains both heme and non-heme iron. But on the bottom with our, I guess these are heads of broccoli, you only get non-heme iron from vegetable sources. There's no heme iron found in vegetable sources. I had this little note to myself because if we were in the class, I would be writing on the board the difference between ferric and ferrous iron and the importance of vitamin C. But we're not there, we're here. And this is what I'm going to try to do to explain to you the importance of the different types of iron. So iron can be found in different ionic states. I'm not asking you to remember the chemistry, but we have ferric iron that comes from non-heme sources or non-animal sources. And we have ferrous iron, which comes from animal sources. What I want you to notice is that one is a +3 and one is a +2. Generally, that's not something you need to remember. But in this case, what you need to know is that it's the ferrous iron found from animal sources that is more bioavailable or biologically available to the body and can help improve iron stores or maintain iron stores. This ferrous iron is what's difficult for vegans to get because they don't eat animal foods. However, when you add vitamin C to a non-heme source of iron, it changes the chemistry of the iron from ferric to ferrous, and it improves the bioavailability of that nutrient. So for vegans who are getting their iron from these non-animal sources, it's a good idea to try to consume them with a source of vitamin C to change the chemistry of it to make it more absorbable or bioavailable. So you should know the difference between ferric and ferrous in that vitamin C helps to make non-heme iron more available. Some food sources of iron. Hereditary hemochromatosis. This is a genetic disorder that affects people from Mediterranean descent, but can also affect others. It's a genetic order that results from a defective iron transport system. The proteins that transport iron in the blood don't work as well. They don't get the iron out of the blood, and what happens is there's an increased absorption of iron from the intestine and high iron levels in the blood. Interestingly, the treatment for hereditary hemochromatosis, well, a low iron diet. However, donating blood is one thing that a person can do to treat hereditary hemochromatosis. Giving blood every 6 weeks or so can help lower iron levels. I thought that was kind of cool. So hereditary hemochromatosis, a genetic disorder resulting in defective iron transport proteins causing an increased level of iron in the blood. In summary, we talked about calcium and phosphorus, how they're important for bone and tooth. They do have other functions in the body, but we primarily focused on bone. discussed type 1 and type 2 osteoporosis. We also looked at iron and its component in hemoglobin and the development of iron deficiency anemia, as well as the difference between heme and non-heme iron. Briefly looked at hereditary hemochromatosis and a couple food sources of these nutrients. All right, see you later.